Okay, I have a job interview today and I'm going for a student nurse technician position. Oh, that rhymed. At my clinical site, they happen to have a job opening and I have an interview today at 1 p.m. Okay, I just wanted to show my outfit real quick. Just have flats on. This is how I'm gonna go in. I hope it's professional looking. Wish me luck. Okay. Okay. I just had my interview and I think it went well, but again, I don't want to be that person. You know what? I'm gonna go home, or I'm going to get a drink actually, and then I am going to update on what happened. But yeah, I like the lady that interviewed me. Now I'm home. I got our meal. So my interview went pretty good actually. When I came in, I was in the waiting room and then I met the lady and she was really nice. She is the manager of the medical surgical floor at the hospital I applied to. She asked me like why I wanted to apply there, why I wanted to be a nurse, why that job in particular, and it was kind of a blur, but I tried relating my experiences to my clinicals and what I did when I volunteered at a hospital before. I just tried to make it very healthcare related. She asked me what shifts I preferred. In my application, I didn't even put anything because I didn't want to be like, oh no, I prefer just this. But she asked me during my interview and I was like, oh, I would prefer days. And she was like, oh, that's good because that's where I have a couple holes. And I was like, oh, what? She gave me her card and she like told me the orientation dates. I think I said it earlier, but I was like, oh, that seems like a good sign, maybe. And then she also asked me like basic questions like what would be a low blood pressure, what would be a high blood pressure, what would be a low pulse rate, what would be a high pulse rate, because the position I applied for, it's for nursing students, but you're still a CNA and you're still like a patient care tech, so it's like just like the basic stuff. But she says I'm like, student nurses are welcome to, let's say like a nurse is putting on a wound vac on a patient, they're welcome to see that like procedures. And I was like, oh, that's so cool. Like it was just really encouraging and she was really nice. When the interview ended, she was like, do you have any questions for me? And I asked about the orientation dates and times because she mentioned it. And then I also asked when I would be hearing back, and she said either I would hear back by tomorrow or by Monday if she's like really busy. And I said, oh, I hope to hear from you soon. And she was like, you will. And I was like, yeah, I'll update if I got the job or not. If I don't get this job, there's always the next one. I'll just keep applying. It doesn't really matter. But okay, so I am currently at parking lot. And while I was at Starbucks, I got a phone call saying that I got the job, and that means that there will be future vlogs regarding my job. So I got a job as a patient care tech, or basically a CNA at a hospital on